Wonderful. We have about 12 minutes for questions. And so if you do have a question, please head to a mic, identify yourself, the institution you're from, and who you're addressing the question to.
I want to thank you, Carolyn, for arranging such a wide variety of funders here. My name is Ann Turner Henson. I'm from UAB Birmingham. This is a question to Dr. Sibley, though. I was so impressed with your work, and as a child health nurse, so much of what happens during the reproductive period has an influence on the children I care for. And so I'm wondering what you see as a trickle-down effect of improving obstetrical care that might improve parents' care of their children during the vulnerable period through childhood.
You know, I think, this is working, yeah. You know, whether you're sitting in rural Ethiopia or you're here in the U.S., my strong sense is that the collaboration between healthcare providers and families and communities is really critical in terms of quality defined through the lens of community as well as family members and health service providers. And so that whole aspect of collaboration and learning together, irrespective of your setting, I think is really key. And so for us, for example, in Ethiopia, it was only through linking the folks at the health services, the health center nurses and midwives and frontline health workers, including traditional birth attendants, with community council leaders and religious leaders and others, were we able to actually address if a woman needs to get care in time, every time, irrespective of place of birth, who are the people that are important in that? And so it was pulling those key people together to problem solve, okay, well, what are the barriers and how do we address them? And they can be everything from cultural barriers to logistical barriers to economic barriers. So I think it's that joining of hands that you see in a lot of the quality improvement work that is happening here in the U.S.
Good morning. I'm Robin Knoebel from Duke University. This question is for Dr. Newhouse. I do physiologic research with neonates in the intensive care unit. Does PCORI fund studies that are looking at the perspective of the infants, since they can't really have a verbal outcome, say?
So one thing that I would say is of the 21-member board that there are consumer advocates that were named to the PCORI board. And you can't say the word patient at PCORI without caregivers being included in that definition. So once you frame a question from the perspective of the patients and the caregivers, and that question is an important question, and you can articulate what the important comparators are and why, and what the outcomes are that people most care about, that becomes a PCORI interest.
Great, thank you.
Other questions? If not, you have now seen us all, and we must have had a memo that came out that we were going to wear red so you could easily find us through the day. I missed it. Oh, you missed that one. It was on this side. Absolutely. I need to remind you about the door prizes at the business meeting. At 10 o'clock, there are posters along in Salon G, I believe. And so we have the business meeting in Salon D, E, and F, and looks like we have some tickets back there, raffle tickets, and then we are back in this room at 12 noon for the awards luncheon. Thank you very much to our panel and to Dr. Lynn Sibley for being our keynote. All right, thank you so much.